Okay, so Assalamu alaikum. In this video, we'll take a look at the clinical conditions associated with the esophagus. The first one is the esophageal varices. We know that at the lower end of esophagus, it's a normal site for the formation of portocaval anastomosis between the portal venous system and the systemic or general circulation. So, if in case the liver is cirrhotic or there's an infection in the liver, that can result in the compression of the portal veins, right? So ये जो portal cavern anastomosis होता है open up हो जाएगा and there will be dilatation of the veins around the lower end of esophagus. This condition is called as the esophageal varices, and if any one of these varices or veins get ruptured, that will result in hematemesis, or the when we get blood in vomiting, that is a condition called as a hematemesis. So hematemesis is very dangerous clinical sign, and that results due to the rupture of the veins at the lower end of the lower end of esophagus. That is called as esophageal varices, the dilatation of veins on the lower end of esophagus, which are basically the portocaval anastomosis. The next condition is the Ecclesia or Ecclesia cardia. It is a condition in which we have constriction at the lower end of esophagus and the passage of food is difficult, which is also called a dysphagia, that is a difficulty in swallowing. So this results mainly due to the neuromuscular incoordination कि in response to passage of food इसको खुल जाना चाहिए sphincter को, superior gastric sphincter, लेकिन ये open up नहीं होता है, and we get a constriction on the lower end of esophagus called as Ecclesia cardia, and this results in dysphagia or difficulty in swallowing. The next condition is that if there is any infection on the lower end of esophagus, तो जो normal epithelium होता है on the lower end of esophagus, that is a stratified squamous epithelium. But if it gets changed to columnar epithelium in response to any infection or any disease, that is called as the Barrett's epithelium, or this esophagus will be called as Barrett's esophagus. So that's another clinical condition associated with esophagus, that in response to any infection or any disease, the normal stratified squamous epithelium will get changed into Barrett's epithelium or simple columnar epithelium. So these were the clinical conditions associated with esophagus, so I consider them important to be discussed here. So thank you so much.